we seen? I think we've seen him before too, right?
Mm-hmm.
Okay.
He again is one of our mushies.
Is he? Okay.
He gets a little cranky. Like I have a rider on Saturdays that he gets really sore back in here, and he'll just pin his ears and not really want the saddle moved or shifted anywhere. So.
Is it a proper fitting saddle?
Yes.
Okay. A lot of times I see with my horse clients, if the saddle doesn't fit, it's going to cause more problems. It could cause, indentations in the spine here, and the muscles. So I always want to make sure that the saddle's fit, because one saddle's not going to fit every horse. Every horse is built a little bit different. So one thing I want to check here. Check his pelvis here, see if he's got some motion here. He does not like me messing with that one, that for sure. No, he doesn't. He's not a kicker, is he? He acted like he wanted to.
Not that I'm aware of. Not saying he won't.
Yep. If you'll notice, I mean, I'll just put a few pounds of pressure on this here. And he's quivering like he's wanting. He doesn't like that at all. So we'll put a little bit of pressure this way. His pelvis may be rotated forward. Okay. What we call an AS pelvis. A lot of times they'll get cinchy. Is he cinchy at all?
Yes.
And because when the pelvis rotates this way, it tightens the abdominal muscles that attach to the front of the pelvis here. And when that happens, when you put the cinch across here, they get irritated. And she just said he's been cinchy, so we're going to take a look and see if he likes that. He's usually going to want to go away from it, and then he'll lean into me. And if you notice, he's leaning quite a bit of weight into me here because it feels better, trying to push the pelvis back this way. He's already liking that. He's chewing up here. So we're going to get a good adjustment here at the left side of the pelvis here. If I push it down, he's quivering like he wants to. Okay, me so. All right, you ready? Let's see if we can get him to lean into me a little bit. Good. He's just not feeling good back here, so real quick. Good. We'll do what we call a butt tuck, basically trying to get him to tighten those ab muscles, see what kind of motion we get in the pelvis here, and he's not willing to cooperate today. There we go. We're going to check the other side here. Good. Don't typically adjust both sides of the pelvis, but sometimes if both sides are rotated forward, good, it'll cause a lot of that back end problems like what she was saying he was acting up for. Right where you were saying, he's got quite a bit of a pain response right here. When I push back here, there's no pain response. His muscles aren't contracting. It's not causing any pain. When I get into right here and push on it, his entire back muscles are trying to tighten because he doesn't like that. It makes it feel worse. So last thing we do is going to poke on it a bunch, but I need to get my stool so we can get up on top and work on that. See, track that pain response up and see where it begins. Begins right there. A little bit of a pain response on the left, but not nearly as bad as it is on the right side here. Well, maybe. Starting to elicit there too, so we're going to take a look and see. All right. You may want to jerk on this one. This one's probably going to be a little bit of painful. Good. There we go. He did good on that one. See, I'm pushing on it just as hard as I was a minute ago. Very minimal pain response. This side, still a little bit. So I'm gonna check his ribs out here. Follow that rib around. Good. Ribs seem to be okay on that side. Let me come around here and check this side out here. You can watch right here, he's starting to breathe a little harder, but when I get right in here, he'll tense those muscles up right there. Good. The ribs don't feel out of place or anything like that. Let me follow the rest of these down here. Good. He's probably still going to be a little cinchy for a couple days, just till some of the soreness works out here. But we'll see if we can get him to do this butt tuck here. Try to get him to rotate his pelvis backwards, tighten those abs. It'll help bring us back here. Do that a couple times.
Okay.
If you keep him up. There he goes.
Okay.
That'll help us work on strengthening those ab muscles. Good. And I came on this side to try to see if we had anything in the withers here, see if I could show you a push move, but he seems to be doing pretty good through this middle part here.